Meanwhile, Hidalgo County's health authority concerned tonight over what he calls a lack of variant testing in the valley. Channel 5's Christian Von Pricing continues our coverage.
Medical professionals like the Hidalgo County Health Authority were already assuming that the Omicron variant was present in our community as they saw it spreading in December. And knowing whether a case is Omicron or whether it's not does allow them to treat it more effectively. The state isn't doing enough testing. In Cameron County today, the first lab-verified sequence proof the Omicron variant is here, but on the ground at medical facilities.
I just ask people to remember the reason we're not finding more is because we're not testing more. And just to remind you that our segmentation or analyzing exactly which type of COVID-19 strain it is requires reference labs. It's a sophisticated study. It's not done at any of the local labs. It's done by the state.
The state of Texas doing that segmentation procedure for a fraction of the patients that report having COVID. Even as doctors say, the treatment will differ depending on the variant. The treatment for Delta different from the treatment from Omicron, such as some of the monoclonal antibodies that were effective before and not effective now.
Ideally, 10% should be done. The United States at 4%. We in Texas are probably close to 1%. And so if you're not testing for it, you're not going to find it. So what are we basing our assumption that it's probably Omicron is the rapidity in which it spreads. Omicron has a history all over the world of the countries that it's taken over, and we see that their cases are doubling every 2 days.
He says December is showing an increase in the valley. And in his work, Melendez assuming Omicron arrived here around December 15th and now multiplying.
It's getting better at infecting people, so it's becoming better at becoming contagious. It's evolving quickly.
Health professionals basing their guesses as to which strain on how quickly it spreads and the symptoms with Omicron.
Scratchy throats, upper airway, night sweats, itchy eyes, profound weakness, as opposed to the lower respiratory system we were seeing with Delta.
Why Texas isn't doing more variant testing? Melendez says it comes down to resources.
It's a relatively sophisticated test that needs to be done in sophisticated labs with the appropriate equipment. And so this has been a problem in that we have very limited labs that can do this that we can rely on.
A variant that continues to spread as the state works to catch up to track these growing numbers. And Melendez says he's looked into the possibility of other universities and labs helping out the state when it comes to segmentation, places like UTRGV. But he says that the rules in place by the state and the resources it would take would simply not make it possible at the current moment. Chris Von Pricing, Channel 5 News.